All right, so you landed an interview for an occupational therapy assistant position. Congrats.
That's awesome.
We're going to do a deep dive today, help you nail it.
Absolutely.
We're using RoleCatcher's career guide and their interview guide for OTAs.
Great resources.
Yeah, some interesting stuff in here. I think you'll be surprised.
Definitely, it's not just about knowing the job description.
Right.
Interviewers want to know if your passion and your understanding really connects with the heart of what occupational therapy is all about.
So let's jump right in. RoleCatcher's interview guide has 10 sample questions,
Okay.
and I think these are fantastic. So question number 1, what motivated you to become an occupational therapy assistant?
That's a big one right out of the gate.
It is a big one. So what are they really trying to get at here?
They are looking for your why. What is the driving force behind you choosing this as a career? Was it a personal experience? Was it an inspiring mentor? Or was there just this one moment in your life where you realized, this is what I meant to do? They want to see that spark, that genuine desire to make a difference in people's lives.
So what would be like a trap, something to avoid with this question?
Don't just give a generic answer like, oh, I enjoy helping people.
Right.
Everybody says that. You really have to dig deeper. Think about an event or a specific story that truly ignited your passion for OT. Maybe it was seeing a loved one recover, or maybe you volunteered at a rehab center. Whatever it is, adding that personal touch really makes all the difference.
Can you give us an example, something that would really impress an interviewer?
Sure. So let's say you start your answer by saying something like, my grandfather, he received occupational therapy after he had a stroke. And watching him go through that process and regain his independence, relearn even simple tasks, it was so moving. I realized the impact OT can have, and I knew I wanted to be a part of that journey for others.
That's really good. I like how you wove in that personal experience, and it really showcases what OT can do for people.
Exactly.
Now think about your own story. What are some specific examples from your life that really showcase that same passion? Write those down. Those can be super valuable when you're prepping. Okay, ready for question 2?
Let's do it.
Okay, question number 2. How do you keep up with the latest developments and trends in the occupational therapy field?
Oh, that's a good one.
Yeah, and it's important because healthcare is constantly evolving.
Always.
So what are they trying to understand about you as a candidate with this question?
Well, they want to know that you're committed to lifelong learning, that you're staying at the forefront of your field because things are constantly changing. So you really have to keep up.
So it's not enough to read an article every once in a while, right?
Yeah, definitely not. You have to be proactive, show that you're really hungry to learn new things, and you want to stay updated.
So how do you showcase that?
Think about professional organizations. Are you a part of any of those? Do you read industry journals? Are you going to workshops? Do you go to conferences? Things like that. All those things really demonstrate a true commitment to ongoing learning.
Okay, so hit me with an answer, like a really strong sample response that really highlights all that.
All right, how about this? I'm an active member of the American Occupational Therapy Association. So right there, you're showing you're part of a professional organization. I regularly attend their webinars, I read their journals, and I even engage in some of their online forums. I find it's a great way to connect with other professionals and learn from their experience. And I always try to attend conferences like AOTA's annual event. I think those are really valuable for staying updated on the latest research.
That's a fantastic answer.
Thank you.
And you really show that you're engaged and you're looking for new information all the time.
It's so important.
So think about it.
Yeah.
Are you doing any of those things? If not, what are some things that you can do to be more proactive about learning? Okay. Question number 3. Can you describe a time when you had to adapt to a new treatment plan for a patient?
Okay.
So this is getting into real-world scenarios.
It is. Treatment plans, they're not set in stone,
Right.
They need to be flexible. They need to evolve based on the patient's progress, their individual needs, and sometimes you run into unexpected circumstances. Interviewers, they want to see how you handle those changes, your problem-solving skills in action.
So what would be a trap here? What kind of answer would kind of throw up a red flag?
I think people get caught up in focusing too much on the problem. So yes, acknowledge the change and talk about the challenges, but quickly shift the focus to the solution. How did you adapt? Did you have to research some new techniques? Did you consult with a supervising OT? You want to show that you're proactive, not reactive, when it comes to changes.
Okay, give me an example, something that really showcases that adaptable mindset.
So picture this. I was doing my field work, and I was working with this child who had autism, and suddenly he just started experiencing these heightened sensory sensitivities. The activities that we had planned, they weren't working anymore. He was overwhelmed. So I quickly consulted with the supervising OT. I did some research on calming strategies, and we adjusted the environment. And by adjusting our approach and just closely monitoring his responses, we saw a significant improvement in his engagement and regulation.
That's a great example.
Thanks.
Because you showed that you can handle those unexpected things that come up, and you collaborated and you got a good outcome.
Exactly.
So listener, think about your own experiences. Have you ever had to think on your feet? What skills did you use? Those are really important stories that are going to make you stand out in the interview. Okay, question 4. How do you prioritize your workload when you have multiple patients with different needs?
That's the reality of the job.
It is. And it can be a lot. So what are they trying to learn about you with this question?
It's all about time management and organization. You know, you're juggling multiple patients and they all have different needs.
Right.
And the interviewer wants to see what your system is. Can you prioritize effectively without compromising the care that you give each patient?
So what's a pitfall to avoid? Like a common mistake?
Don't say you just go with the flow or you prioritize based on whoever's the loudest, you know?
Right.
You really need to demonstrate that you have a structured approach, a system that makes sure everyone gets the attention they deserve.
Okay, give me an example of an answer that shows that structure.
I begin each day by reviewing patient charts and making sure that I identify any immediate needs or any time-sensitive tasks. From there, I create a schedule, taking into account the complexity of each patient's treatment plan, making sure I'm allowing enough time, also factoring in any pre-scheduled appointments. And if the OT has given me specific instructions, I make sure I note that as well. But of course, I remain flexible throughout the day, adapting as needed while maintaining clear communication with the team.
I love that. Organized, adaptable.
Right.
It's a great answer.
Thank you.
So listener, how do you handle those competing priorities?
Yeah.
Do you have a system? It's a good time to think about it. See if you can tweak anything. All right, question number 5. How do you handle difficult patients or situations?
Oh, we all have them.
Yeah, so this one can be tricky. What are they trying to get at here?
I think this is a question that's really testing your emotional intelligence, because every healthcare professional is going to encounter patients that are challenging. They want to see what your communication skills are like. How do you resolve conflict? Can you maintain professionalism under pressure? All of that.
So what's a common mistake that people make?
Don't get defensive. I think it's really easy to do that.
Right.
Avoid saying things like, I just ignore them, or I pass them off to someone else. Instead, approach it as an opportunity to try to understand. Why are they being difficult? Are they in pain? Are they scared? Are they feeling like they've lost control?
Okay, so give me an example that really shows that you're trying to understand.
Okay. When I'm faced with a difficult patient, my first step is always to try to understand what's at the root of their behavior. I try to use active listening skills, make sure that they feel validated. Even if I don't necessarily agree with what they're doing, I want them to know that I understand where they're coming from. I remain calm, I keep a respectful tone, and I clearly explain what we're doing, what the purpose is, and what the benefit of the therapy is. If the behavior continues, then I'll consult with the supervising OT to see if we need to change the approach or if we need to seek some additional support.
That's a great answer because you really showed empathy. And you're going to try to solve the problem. You're going to work with the team.
Exactly.
So, listener, think about a time where you had to deal with someone who was difficult.
Yeah.
How did you handle it? Could you have done anything differently?
It's always good to reflect.
Yeah, it helps you prepare for those harder questions.
Mm.
Okay, question number 6. How do you encourage patients to participate in their treatment plan? So what's the interviewer trying to learn about you with this one?
Well, this goes beyond just giving instructions. It's about really fostering a sense of partnership with the patient.
Right.
Interviewers want to know, do you understand how important it is that the patient is motivated to get better? You really have to be a coach, a cheerleader, and a therapist all rolled into one.
That's a good way to put it.
Thank you.
So what would be a pitfall, like a trap to avoid with this one?
Don't fall into that trap of having a one-size-fits-all approach.
Right.
Because everyone is so different. Just saying, why just tell them to do it? Shows a lack of sensitivity, a lack of understanding that each patient is unique and has individual needs.
Okay, give me an answer that shows a more personalized approach.
Okay, here's an example. I really believe in building that strong therapeutic relationship with my patients, one that's based on trust and understanding. I listen carefully to their concerns and what their goals are, and I try to figure out their preferences, I try to get them involved in the process, making sure that they really understand the purpose of everything that we're doing. And I try to incorporate things that they're interested in. Like, for example, if a patient loves to garden, I might try to incorporate some gardening-related tasks into fine motor skills exercises. I try to make it meaningful to them.
I love that. You're making it personal. So, listener, how do you motivate people? What strategies could you use to encourage patient participation? Think about that.
Okay.
All right, question number 7. Can you describe a time when you had to advocate for a patient's needs? So what are they looking for here?
Advocacy is critical. This question is trying to figure out, are you willing to speak up for your patients, especially when they might not be able to do it themselves?
Right.
It's about knowing the system, being a good communicator, and making sure that your patient's voice is heard.
So it's going above and beyond.
Yes.
What's a mistake people make when they're answering this one?
Choosing an example that's too passive. Like it doesn't demonstrate a real challenge.
Okay.
So saying something like, oh, I asked the nurse for an extra blanket, it doesn't really showcase your advocacy skills.
So give me an example that's really strong.
Okay. Imagine this. I was doing a clinical rotation, and I was working with this patient. He was nonverbal and had limited mobility.
Yeah.
And the initial discharge plan, it just wasn't addressing his needs, and it was kind of putting him at risk. So I carefully documented my observations. I consulted with the supervising OT, and I went to the interdisciplinary team and presented my case, advocating for home health services, getting him the adaptive equipment he needed. And as a result, we got the plan revised, and we made sure that he would be safe at home.
That's a great example.
Thank you.
You saw the problem, you took action, and you got a good outcome. So, listener, have you ever had to advocate for someone? What did you learn from that? Those are the kind of stories that they want to hear.
Definitely.
Now, before we hit those last 3 interview questions, I want to take a little detour because there's a tool that can help you with your interview prep.
Okay.
And that is RoleCatcher's AI. I am really intrigued by how it can tailor your answers for specific job roles.
Oh, it's amazing.
So tell me about this.
So what sets RoleCatcher apart is that it is personalized. You can actually put in the job description that you're interviewing for, and the AI is going to analyze it. It's going to figure out what are those key skills and experience that they're looking for, and then it helps you craft your answers to highlight those exact qualities.
So it's almost like you have a little interview coach.
Yeah, it is. It's like a personal interview coach.
Yeah.
And not only that, it's not just about writing. It also has a video practice feature where you can record yourself answering questions, and the AI will analyze your delivery, your tone, your pacing, your body language.
It's like you have this mock interview.
Exactly. Yeah. It's like a mock interview, and it gives you feedback.
And you can see those subtle things that you might not realize that you're doing.
Precisely. So it helps you refine how you communicate.
So listener, if you are serious about acing this interview, check out RoleCatcher's AI tools. They can give you that extra little push.
Absolutely.
Okay, now back to our questions. We've got 3 more.
Let's do it.
All right, question number 8. How do you manage patient confidentiality and privacy? Now, this seems pretty straightforward, but I bet there's some nuances.
Absolutely. A lot of people kind of know the basics about patient confidentiality.
Right.
But this question, it's meant to really figure out how well do you understand this? How deep does your knowledge go? Especially regarding hyperregulation.
So it's not just saying I won't gossip.
Definitely not. The interviewer wants to hear that you understand HIPAA, that you've internalized it, the legal and ethical implications, that it's something that you live by.
So what would be a way to really make an interviewer worried, like a mistake to make?
Don't downplay how important it is. Don't be vague. Just saying something like, oh, I'm pretty good at keeping things confidential.
Right.
You want to really show that you understand what could happen if you had a HIPAA breach and that you take the necessary steps to prevent it from happening.
Okay, so what would be a really good answer that shows that depth of knowledge?
How about this? I always make sure to follow HIPAA regulations to protect my patient's privacy. That means I never discuss their information with anyone who's not authorized to see it. I always make sure all the documentation is stored securely, and I'm very careful about disposing of confidential materials properly. And I always make sure that the patient feels comfortable and that their privacy is respected during their therapy sessions.
So you're covering a lot of ground there. You're thinking about documents, you're thinking about face-to-face.
Yeah.
That's great. So, listener, are you being that thorough? Think about it. Okay, question number 9. Can you describe a time when you provided education to a patient or their family? So what's going on here? What are they trying to assess?
Patient education is a big part of OT, and this question is really about showcasing your communication skills and your empathy,
Right.
and also your ability to tailor information to that particular patient and their family.
So they want more than just facts.
Yes, they want to know, can you go beyond just relaying the facts? Can you really empower the patient so they understand their condition and can actively participate in getting better?
So what's a pitfall here? Like a trap to avoid?
I think people tend to focus too much on the information and not enough on the interaction.
Okay.
So the interviewer, they don't just want to know what you told them. They want to understand how you engaged them, address any concerns, and make sure that they really understood the information.
So give me an answer that shows that interaction, that engagement.
Sure. So you could say something like, during my field work, I was working with a patient, an elderly woman who had recovered from a fall, and she was learning to use a walker. But she was really anxious about going home. She was worried about falling again. So I sat down with her and her daughter, and I explained all the walker techniques, how to use it properly, and I addressed their safety concerns. Then I demonstrated the techniques, I let them practice with me, and I gave them some written instructions with clear illustrations so they could take that home and remember. And just to make sure they had support beyond our sessions, I gave them contact info for a local support group.
I love that because you showed that you were listening, you were explaining, you were demonstrating.
Mm.
That's great. So, listener, think about times when you've had to explain something to somebody and they were struggling. What did you do to make the information clear and understandable? Okay, this is the last one. This is a big one. Question number 10. How do you ensure that patient goals are met and that you're tracking their progress?
Big one.
This is like the heart of OT, right?
Yeah, this is it. This question is trying to see, do you understand goal setting, data collection, and evidence-based practice? The interviewer wants to know, are you just going through the motions? Or are you invested in making sure that your patient is successful?
So you want to be organized, you want to be analytical, you want to be results-oriented.
Exactly.
What's a mistake that people make when they're answering this one?
I think they make it sound too mechanical. Just saying something like, I fill out the paperwork, shows a lack of real engagement, like you're not thinking critically about the process.
All right, so what would be an answer that would really stand out and show that you are taking that more holistic approach?
I would say something like this. My approach to goal setting and progress tracking is really collaborative. So I work closely with the supervising OT, with the patient, to come up with some really clear, measurable goals and ones that are meaningful to that particular person. And then, to track the progress, I use a variety of different methods. I use standardized assessments, observational notes, and of course, I always get feedback from the patient. And then I review the data frequently, looking for any trends, any barriers to progress, and I'll adjust the treatment plan as needed. So, for example, if a patient is struggling to meet their mobility goals, then we might try a different intervention. Maybe we can find an assistive device that can help support them.
I like that answer because it really showed that you're going to be working with everyone.
Mm-hmm.
You're personalizing it, and you're going to look at the data and adjust as you go.
Exactly.
So, listener, how do you approach goal setting in your own life? Do you think you could use some of those strategies in your career? That's a great question to think about. Okay, we tackled all 10 of the interview questions from RoleCatcher.
That was a lot.
That was a lot. But remember, this is just the beginning. Every interview is going to be unique.
It is.
You might get follow-up questions. You might have to go more in-depth.
Mm-hmm.
That's where RoleCatcher's AI can really help you.
Yeah.
Because it can analyze those specific job requirements and really tailor your answers.
It's so helpful.
And, of course, you can do that video practice.
Yeah.
So you can fine-tune how you deliver those answers.
Absolutely.
Okay. So now we're going to shift gears.
Okay.
We're going to look at RoleCatcher's career guide.
All right.
And we're going to explore, what does a career in occupational therapy actually look like? What are the different stages?
That's important to know.
It is. What opportunities are out there? Get ready. This is where things get really interesting.
It is. It's kind of like climbing a ladder.
Yeah.
Each rung is a new level of expertise and responsibility.
Okay, I like that visual. So let's start at the bottom rung, that entry-level OTA. What are they typically focused on?
Yeah, so at the entry level, it's all about absorbing those fundamentals. You're assisting the occupational therapist, learning the ropes, and really honing those essential skills. Think of it as a hands-on apprenticeship where you're observing, participating, and slowly building your confidence.
So what kind of tasks would an entry-level OTA be doing?
You'd be setting up treatment areas, gathering materials, assisting patients with their exercises, documenting their progress, and just generally making sure those therapy sessions run smoothly. It's a lot of observation and learning by doing.
So really building those core skills like communication, empathy, attention to detail.
Exactly. Those are really the foundation of a successful OT career.
All right, so let's climb up to that next rung, the junior OTA. What's changing? How are the responsibilities evolving at this stage?
So as a junior OTA, you're taking on more direct patient care responsibilities. You're still working closely with the OT, but you're starting to implement treatment plans a little more independently. You're also interacting more directly with those patients, educating them on adaptive techniques and home exercises.
Kind of that shift from doing to leading that we talked about earlier.
Exactly. You're gaining more autonomy, applying your knowledge, and starting to make a bigger impact on patient care.
Okay, now I'm curious about that jump to the intermediate level. What does it take to reach that stage, and what kind of challenges and rewards come with it?
The intermediate OTA is really hitting their stride. They're conducting more comprehensive assessments, developing and implementing treatment plans with a higher degree of independence, and they even might be supervising junior OTAs, sharing their knowledge and expertise.
Wow, that's a lot more responsibility. It sounds like you're really shaping the direction of care at that point.
You are. You're a key player on the OT team, and you're contributing significantly to those patient outcomes. It's challenging, but incredibly rewarding.
All right, so we've reached the top rung, the senior OTA. What sets this role apart? What are the qualities that make a senior OTA really stand out?
Senior OTAs, they're the leaders, the mentors, the visionaries in the field. They're overseeing entire programs, developing and revising treatment protocols, collaborating with OTs on research and quality improvement initiatives, and a lot of times they're even representing the OT department at conferences and in those interdisciplinary meetings.
So they're really shaping the landscape of occupational therapy. They're having an impact on how care is delivered within their organizations.
They are. And it takes a special combination of skills and experience to get there. Clinical expertise, leadership qualities, communication skills, and a deep commitment to advancing the field.
The career guide has those example profiles for each stage.
Yeah.
And I noticed a phrase in the senior OTA profile that really jumped out at me. It said, lead and oversee the implementation of comprehensive occupational therapy programs. So can you break that down for us? What does that actually look like day to day?
Sure. So it basically means that you're taking a broader, more strategic approach to OT. You're moving beyond that individual patient care to design and implement programs that address the needs of a specific population or a setting. So think about maybe, developing a fall prevention program for an assisted living facility, or creating a sensory integration program for a school district, or even like spearheading a community outreach program to promote healthy aging.
So you're really thinking big picture. You're not just treating individuals, you're impacting entire communities.
Exactly. And that's what makes that senior OTA role so exciting. You have the opportunity to use your expertise and your passion to make a real difference on a much larger scale.
So listener, imagine yourself 10 years from now, leading a program that really speaks to your passions, your values. What would that look like? What population are you serving? What kind of impact are you making? These are all really great questions to think about as you're picturing your future in this field. Okay, so we've covered those different stages of an OTA career, but there's something else that's crucial for success in this field, especially since it's always evolving. That's continuing education.
Oh, absolutely. Healthcare, it never stands still. There's always new research, new technologies, new approaches to care. So staying current isn't just a good idea. It's really an ethical obligation for any healthcare professional. And OTs especially need to keep up with the newest developments in assistive technology and those therapeutic techniques and evidence-based practices.
So how does an OTA stay ahead of the curve? What resources are out there to help with this lifelong learning?
Well, professional organizations like the American Occupational Therapy Association, they're like gold mines of information and learning opportunities. They offer continuing ed courses, conferences, webinars, publications that keep you up to date. Joining your state or national OT association is great too. You get to network, find a mentor, and grow professionally.
And what about specializations? I know there's so many different areas within OT like pediatrics, geriatrics, hand therapy, mental health.
That's right. Getting those specialized certifications, especially in an area that you're really interested in, can open up new doors and let you develop a really deep expertise in a specific area.
It's like choosing your own adventure within the world of OT. So listener, what areas spark your curiosity? What populations do you really feel drawn to? what specializations might align with your long-term career goals. It's worth taking some time to explore those options and see where your passions might lead you. Now, before we wrap up this deep dive, I want to touch on something that's often overlooked when people talk about careers, but it's so important, especially in a field like occupational therapy, and that's the emotional side of the work.
It's a huge part of the job. Working in healthcare, especially in a field like OT, where you're so hands-on and emotionally invested, can be both incredibly rewarding and incredibly challenging. You're working with people who are facing really difficult situations. They might be in pain, they might be frustrated, or they're grieving the loss of their abilities. And you're there with them through it all, seeing their struggles, their triumphs, their vulnerabilities. And it's impossible not to be affected on a personal level.
It's that human connection that makes OT so powerful and so unique, but it also requires a certain level of, emotional resilience.
Absolutely. And that's why self-care is so important. You have to develop those healthy coping mechanisms, set boundaries, and make time for activities that really nourish you, that nourish your soul.
So what are some things that OTAs can do to handle the emotional side of this work?
Honestly, it's about finding what works best for you. Some people find it in nature. Some people find it through exercise, through meditation, creative pursuits, or spending time with their loved ones. Whatever it is, the key is to build up a toolbox of strategies that you can use when you feel depleted. And never be afraid to reach out to a therapist or a counselor. That's not a sign of weakness, it's a sign of strength. It shows that you're self-aware.
It's like putting on your own oxygen mask first, right? You can't pour from an empty cup.
Yeah.
So listener, what are your go-to self-care practices? What are your strategies for dealing with stress? That's something important to think about, not just for you, but for your success and your longevity in this field. Okay, we've covered so much today, from interview tips to career paths to the importance of self-care. Before we wrap up, I want to bring it back to RoleCatcher and just emphasize how those AI-powered tools can really help you personalize your interview prep and give you that extra boost of confidence.
It's a game changer. By analyzing those specific job descriptions and giving you feedback on your answers and your delivery, it helps you showcase your strengths and address any areas where you might need a little improvement. It's like having a personal coach and a mock interviewer, all in one platform.
It's an amazing resource, especially for people who might be a little nervous about that interview process. So listener, don't underestimate the power of preparation. Use these tools to your advantage and go into that interview feeling confident, ready to shine. Now, as we get to the end of our deep dive, I want to leave you with a final question to consider as you start this exciting journey. What kind of work environment would best suit your personality and your strengths as an OTA?
That's a great question to ask yourself. It's all about finding the right fit, a place where your skills and your passions really align with the needs of the population you're serving and the culture of the organization.
Exactly. So would you thrive in a fast-paced hospital setting, a more nurturing school environment, a community-based program, or maybe a specialized clinic? Each setting has its own unique challenges and rewards, so it's really important to think about what feels right for you.
And remember, this is just the beginning. This deep dive, it's just scratched the surface. RoleCatcher has a ton of resources to help you explore different work settings, learn more about employers, connect with OT professionals. Use those resources, ask questions, attend industry events, and most importantly, trust your gut. It really is a personal choice. Some OTAs, they do great in that fast-paced hospital environment, always moving. Others, they find they're better suited for a school, that nurturing kind of atmosphere. Or maybe working in a home health agency where it's really community-focused.
Yeah, it's all about finding that perfect spot where your strengths and your passions line up with the people you're serving and the culture of the place where you're working. And, that perfect environment for you, it might change as you get more experience.
Of course.
Your interests might shift.
Absolutely. That's one of the great things about OT.
Lots of room to grow.
So much room for growth and exploration.
Now, RoleCatcher, they can be a great guide as you're going through that.
Oh, yeah, for sure.
Their platform, you can actually explore different work settings.
That's right.
You can research potential employers. You can connect with other OTs.
It's amazing.
And you can even get personalized career advice.
It's like having this incredible toolkit to help you navigate your entire OT career.
So listener, think about it. What are you thinking right now about your ideal work setting? Do you see yourself with kids in a school, helping adults get back on their feet in a rehab center? Or maybe working with older adults and helping them stay in their homes? Take some time, think about it, and use RoleCatcher's resources Really dig into the possibilities.
And don't be afraid to connect with OTAs who are already working in those settings. Talk to them.
Great idea.
Ask them about what it's like. What are some of the challenges? What do they find rewarding? Hearing about it firsthand can be so helpful when you're figuring out what path you want to take.
Now, before we wrap up this whole deep dive,
Okay.
I want to come back to one of the key themes that we've been talking about, that personal connection, that human touch that's so important in occupational therapy.
That is at the heart of everything we do. You know, building relationships, building that trust, and understanding what each individual needs and what their goals are. It's about looking beyond that diagnosis, seeing the person, and helping them live their best life.
It's about empathy and that human connection that can make all the difference.
It really can. And that's something that technology can't replace.
Never will.
Never will.
So, listener, as you're prepping for your interview and you're thinking about your career in OT, remember, it's not just about skills and the technical stuff.
Right.
It's about bringing your whole self to the table, your empathy, your passion, and your ability to really connect with people.
Those qualities, they're going to come through in how you interact with your patients, how you work with your colleagues, and even how you answer those interview questions.
So hold on to those qualities, nurture them, and let them guide you. Because I have no doubt that you have what it takes to be an amazing occupational therapy assistant.
You can really change people's lives. Help them regain their independence, help them find joy, and live their lives to the fullest.
What a privilege. We wish you the best of luck on your journey to becoming an OTA.
Congrats on taking this step, and remember, we're rooting for you.
And that's it for our deep dive into the world of occupational therapy assisting.
We hope you found it helpful and inspiring.
And remember, RoleCatcher is there for you every step of the way. Use their resources, connect with their community, and use their AI tools to improve your skills and really stand out in that interview.
Go get them.
Make us proud.